It's Dr. Mora here. I'm going to do a knee injection today. This is a knee injection a little different than the past post that I did where I injected the patient sitting down. In this case, I'm injecting the patient lying down. Now, why am I doing it lying down? Because it allows me to use my ultrasound and I'm able to guide the needle into the right spot, especially when I'm injecting these thick injectables that have to be put into the correct compartment and not into the soft tissue. So today I'm doing a left knee injection. Patient is lying down, and I have a little bump over here just to keep the leg as straight as possible. And what I do next is this. So this is what you need for the setup. Let me just show you. 27 gauge needle with 1 cc of lidocaine, the Lidocaine, Betadyne, and alcohol, and I will be switching the needle to a 22 gauge. So if you use the 27 gauge at the beginning, the patient will not feel much pain at all. So this is the start. So this is what we're going to do. I'm going to start by just showing you some anatomy. Here's the patella, the top of the patella, the quadriceps tendon, okay, the femoral shaft is like that, okay, patella tendons over there. There's one little point like right here where if you push the patella this way, you can see the lateral edge of the patella there, and just under it, right there is the spot. So what you do is you toggle the patella back and forth like this. I can feel the quadriceps tendon is actually over here. I can feel the quadriceps tendon right there. That's the spot right there. There's a soft spot right there. You don't want to go through the quadriceps tendon because it's, number one, it's too firm and it's very hard to get through and it hurts. You obviously don't want to hit the bone. You want to go right here. So once again, I mark it. I made a mark. I'm intentionally making a mark with a pen. It doesn't have to be a Mont Blanc pen. Any pen will work. And then I've already cleaned it off with some alcohol. Then we use our Betadyne in a circular radial fashion. You have to be meticulous with your technique. 27 gauge needle with 1 cc of lidocaine. So once again, spot, piquete pequeño, okay? Mm-hmm. Right under the skin. And then I kind of distract them with a little bit of pressure like this. Aim my needle up. And it should be in the joint right here. And if I'm not, then what I'm going to do is I'm a little bit high. I can tell I'm a little high. I'm going to lower my needle. And there it goes right there. So that's a good learning lesson. It should just pop right in. And if it doesn't, it's in the wrong spot. I moved it about 3 millimeters and I'm in the right spot now. So what I'm going to do is I'm going to change my needle. Why am I changing the needle? Because this Lidocaine does not go through a 27 gauge needle, but a lot of people don't know this, but Orthovisc does go through that. So if I had Orthovisc here, I could just inject it right now, but I don't. This is a little thicker. So I switch over to a 22 gauge needle. I do a switch. I follow the trajectory that I just had. Once again, distract the patient a little bit. Make sure that I'm in. There it is. Boom, feels really good. I bring my ultrasound just to make sure. So what I do is put a little gel up there. ¿Cómo se siente?
Bien.
Okay. ¿Ha sentido dolor?
No.
No. Okay, muy bien. So I'm really careful with my gel. And then I look at my ultrasound. Let me move it a little bit here so I can see better. Okay, I'm looking around the 3 o'clock area, looking for my needle. There it is right there. That's the needle right there. You see it on the right side. Yep, and I just squirt a little lidocaine. I can tell I'm in. Synovium is below me. Quadriceps tendon is above me. That is a good spot right there. So then, ¿todavía se siente bien?
Mm-hmm.
Okay. So then I go like this, and now I do a switch. make sure it's nice and tight. I go back to my ultrasound because I just want to make sure that it's still a good spot for me. There it is. It's to the right side, right about 3 o'clock. There it is, yeah. So now I inject my, see how it's increasing the space? See how the space increases? That's the joint space that's increasing in size, and then you can come on back over here. And now I know I'm going in, the patient's comfortable, they're not feeling any pain, and that's because I'm injecting into a space. All it's doing is expanding. Now, if there's not a lot of space, the patient will feel pain, but for the most part, at this point, it's a painless injection. So once again, the key is to find the right spot, not go through the quadriceps tendon, not hit the patella tendon bone, and not inject into the synovium. 27 gauge needle for skin and just below the skin. Leave the needle in for trajectory. Do a switch, 22 gauge needle. You don't always have to do a 22 gauge needle, but in this case we do because we're using a thicker type of hyaluronate. And confirm the placement with ultrasound. Inject freely, there should be no issues. ¿Cómo se siente?
Bien.
¿No problema?
No,
¿Sintió dolor cuando lo piqué?
un poquito nomás de la primera vez.
Pero todo bien cómodo?
Sí.
So he felt a little pain the first time around when he first got hit. And once again, one thing to help is when you move the kneecap so you can kind of see where it's at. And now, just wipe things off. And that's it. So this is Dr. Mora. Just wanted to show you what I call my near painless knee injection, this time in the supine position using ultrasound for guidance. Thank you very much.